The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
And we're back, folks. It's another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. And today, it's all about your molars, your cuspus, and is it incisors is the correct word?
Yes, incisors.
Incisors. and with me, you hear the voice of Dr. Thammy Powery. She is a dentist over there at HSA. And I was telling you earlier, the fun thing I remember about going to the dentist was having the bubblegum toothpaste and being fluoride. You get all these wonderful colors and flavors. Now that's kind of a norm. You can go out and buy the bubblegum and buy those types of things.
It is.
But tell me, go ahead and introduce yourself to our public.
Right. So I'm Dr. Thammy Powery. I'm from West Bay. I've done all my school here and everything. So I'm a little quiet and stuff, not really outgoing. Mm-hmm. But
you're a powerhouse in the dentistry world.
Well, I hope so.
Awesome. And the thing about it is, you're a, as they say, homegrown product. You live here, you work here, you grow here, and so kind of it's a normal thing for you. But for us, that's like your rock star status that we have somebody in the industry from our hometown. So, thank you so much for doing what you do. Tell me, how'd you get into dentistry? Out of all the professions in the world, how come there?
Well, funny enough, when I was smaller, I used to love banking and the tellers and filling out the little forms and everything. But as I grew older in high school, I noticed that we were lacking especially in the medical field. Now, being a little artistic in school, I wanted to pursue art and whatnot, but my mother, bless her, she's been my rock, said, why not go into something, in the medical field? I'm sure there's something that you can do your art in.
Right.
So I'm like, okay, sure. So I started looking up things, and then we had the work experience as all high schoolers go into to see the different fields.
Okay.
I was like, okay, I want to be a vet. I like animals. I think this should be good. Did my vet and whatnot? Sure. Being the applications to school, no. She's like, well, what's your backup? Think of something else.
Mom,
so I'm like,
moms.
Mom, yes, love her. So I'm like, okay, what about dental technician? That's pretty artsy,
right?
So went in on the work experience at the HSA back in the day and loved it. I got hands-on experience. I could help the technicians and everything. So I'm like, okay, let me apply to this. So tried applying. She's like, well, it's a technician. Why don't you go to the root of the matter? Doctor. I'm like, but doctor, I'm not, all right, fine. Took my sciences in school. Didn't excel, to be honest. I'm not the most smart student, but I have,
the
I keep at it.
Determination.
Exactly.
The gumption, as they say.
Yes, and my mother behind me.
Double gumption.
Right. So did everything, got in. To be honest, I started working as an assistant as well. And it was amazing. To see someone go from being toothless to have their dentures put in, and it just completely changes them.
Right.
It's gratifying to see that. Or when a child that has really bad front teeth and you fix them up and then they start smiling again. All that is really nice. There are difficulties to it.
Right.
I'm not going to sugarcoat it. There are extreme difficulties to it. But at the end of the day, it is gratifying.
And see, that's the thing I think that people forget. Dentistry is really an art craft because and I say that because you see the results. Most times when you're a doctor, the result is, oh, you feel better.
But funny that you say that. We are so hated. Unfortunately, because people see us as we give them pain. They come with pain, we give them more pain.
Right.
But afterwards, they're fine. They're all
fine.
dandy.
Right.
They forget about that, but they still hate us. And they love the doctors.
You know, I think it's the old idea of back in the day, like all of the old movies I remember growing up, when you came to pulling a tooth, that was like, oh my gosh, they're gonna pull it too, and the dentist came out and it looked like car tire.
Actually, they used to be pliers. That's what they used to be. That's how they evolved.
Right.
So yes.
Yeah, and that I remember all of the old movies, the westerns, when they called the dentist and he showed up with the medical bag, and you saw all of these. I call them archaic tools.
Oh yes.
Instruments, and you were like, oh my gosh. And then, as I said, dentistry has evolved so much over the last, couple of years. I mean, painfulness and things like that is always a sign of it. But then with rapid succession, you get better quicker. The medicine, even, before I remember going to the dentist and they would take an x-ray and I felt this lead shield, and I felt like, oh my God, what am I doing here? All of that has changed. Some all digital, computerized and things of that nature. How has it been? Because you've been in the industry for a little while. Tell me a little bit about the changes that you've seen in it.
Well, like you said, more studies have come out in regards to the lead aprons. Sometimes it's contradictive versus, the usefulness of it. It also depends on the exposure, how much exposure. Most of our dental radiation is similar to going on a trip to Jamaica or to the BRAC. You get the same amount of radiation.
Of course.
Right?
Of course.
Now, there are when
procedures
you do other procedures that you do require a bit of protection and whatnot. The only reason I know that we get criticized like, oh, you tell us that it's not an issue, so why are you running outside every time you're going to do it? It's because we do so many in the day. Our exposure is a little more than the regular person that goes once every month, per se.
And that's assuming that you go every month. Cause
exactly.
Some people, a dentist trip may be, once or twice a year. On average, what should a healthy adult, what should his dental or her dental regimen be? Right.
So the regimen should be at least one yearly checkup. In that checkup, you make sure that everything's okay. If anything needs doing, then that's where your follow-ups come in, that you do your fillings and whatnot. Your cleanings now should be twice a year if you have healthy gums and you keep up with the regime. Now, all depends. If you have some sort of gum disease, then your cleanings are going to be a little bit more in the year. So 3, 4, all depending on the severity. But on the normal, it's once a year for your checkup, where you get all your x-rays done and everything, and then your cleanings twice a year.
Nice. And for kids, because kids have growing teeth.
Of course.
And I always remember, my mom, make sure you brush your teeth before you go to bed after your meal.
Of course.
And literally, that was because, that was the norm of it. But there is benefits to it. There is truth behind it.
There is. Personally, I recommend as soon as baby can handle, at least try and get them used to the dentist. Not that you're going to take them when they're in pain, where the whole fear of the dentist comes in, because you only take them when they're in pain. They will know that they will refer to that as, I'm going to get more pain.
Right.
So you try and get them familiarized with the dentist from before then to check their gums. Even though they don't have any teeth, you check their gums, make everything's okay. When their first tooth start popping out, you can also take them just to clean the little gum and whatever, and they get used to going to that routine. So by the time, if God forbid there's an issue,
Mm-hmm.
they already know, well, the dentist's here to help me. It's not that they're going to hurt me. I
Right.
already know what's going on. I know they're going to use this and that and whatever. So I'm a little bit more calm.
Right, a little bit more calmer
Yeah.
on that. And I always say, you know what? It's the first time you go to the dentist in your preteen or you're in teen, that's a traumatic, because you kind of aren't set for somebody saying, open your mouth wider. You're not, your mindset isn't there. So
And then you hear everything else that everybody else goes through.
Right.
That has already been going from. So you're scared of what's going to happen. That's understandable, like anything.
And I think that is where we need to kind of change the regiment and the idea of it. And I think Cayman is probably one of the places I've seen with pretty good teeth overall.
Yeah,
Most of the
the
smiles
majority.
that I've seen,
The majority, yes,
the majority
that is
of
true.
smiles that I've seen from people have been on the positive side. I've been some places where I've seen whole families, and I'm like, wow, and I'm thinking, because they always say, when you get to the dentures and you have the tooth decay is pretty serious.
It is. It very much is. Which is why we have the advantage that in our schools we have the therapists that help out the pediatric dentist.
Okay.
So it makes our job a little bit easier if they start being seen from school, in that they will start getting their little sealants. If in any case they're regular cleaning. So by the time they're out of high school, they're back in the system for the adults. And their checkups, cleanings, everything.
Understandable. So I know your job comes with a lot of great challenges. What is the most fulfilling one for you?
Well, I think I mentioned it. The satisfaction of seeing someone that wasn't smiling before, that had issues, that felt self-conscious, just talking, smiling a big bright smile.
Right. It's not in their mind that someone's looking at my teeth.
Actually, unconsciously, everyone is.
Really?
So if you notice, people that have issues with their smile or know that something's wrong with the teeth, they tend not to smile. Sometimes kids that have braces, because they find it, I don't know, stereotypically not right.
Right.
They will not smile. They'll just, cover or always have self-consciously.
Very-
if you
very
pay
self-conscious.
attention,
Even though it's not top of mind awareness, it's still noticeable, because even to this very day, I'll see people who cover their mouth when they're eating because they don't want you to see. And I'm thinking, well, not the chewing, but their teeth is what they're very concerned of. Or they'll go in the mirror and they're looking at their teeth.
right. So that's all part of what our personality is. That helps us with our self-esteem. So seeing someone go from having a low self-esteem to a good high self-esteem, to be able to talk to you because you help them get their denture in the teeth or fix their teeth, that's gratifying to me.
Understandable. I'm gonna put you on the spot right
Okay.
now. I know. Surgical wise, how long does that take you from, say, someone with an issue to having the smile, as you say?
Okay. Well, it depends, as every case is different.
Is different, of course.
So someone that has an issue, it may be that they have several issues in their mouth that need sorting. So
Okay.
it can take a good couple months to get them to a place where they're good. That's also bear in mind that sometimes things pop up, they can't make the appointment, or I'm away, or whichever dentist
Right.
is not there for whatever reason. So a clash of schedules is always going to happen. But on average, it takes a good couple months, maybe 6 months,
Okay.
give or take, depending on availability as well.
Okay. And that's including healing time and things of that nature.
Right. So if it's extractions that they're doing to get denture, for example, I normally tell them to wait maybe 2 weeks or 3 weeks for the tissues to heal so that we can start doing whatever denture procedure. That's if it's only one tooth. If it's several teeth, then you have to wait till all those teeth are out to be able to start anything.
Okay, to start the procedure. of
If
healing.
it's fillings as needed, all depends on the fillings,
Okay.
how many they have, how many they need.
And I'm sure that always was, to me, was the, I remember mom and dad, candies, and I think we're kind of good with Cayman when it comes to the sweet tooth. We do have the sweet tooth, but it's kind of the natural sweetness versus the artificial. Now, I may be wrong. It's
No,
just,
well, in that aspect, I may be different from other dentists. I have a sweet tooth. And my thing is, it's not bad to have the sweets.
Okay.
Have a sweet. But it's just the consistency of having the sweets. How many you have right next to each other and not letting your body or your saliva get back that neutral pH. If you keep throwing stuff in and not brushing or drinking water to try and neutralize it, yes, you're going to have a high
Have
risk of
issues
getting
with that.
cavities.
And would you say, because our younger generation, that should even be more so with them because their teeth are kind of the tender stage, the enamel hasn't built up?
Yes, I would definitely agree with that. They, by all means, have your sweets, but remember, you have to drink your water, you have to brush your teeth, you have to keep up with your dental visits, your cleanings, all the rest of the stuff. It's not bad to have them. It's just you have to keep up with the work to keep them.
You have to keep up with the work to keep them. So, mentoring, I know, you did your schooling here. Give me a little bit about that.
Well, practically the whole of the HSA Dental Clinic have been my mentors because I've known them since I was in high school.
Okay.
So
And we're not going to date you or
no,
put
by
that.
all means not. Everyone there, honestly, from reception staff, administration staff, the different dentists that are there.
And that's the beauty of it. You kind of came in from the start of the system and worked your way to the pinnacle of it, which is being the doctor of dentistry there. So you kind of know every facet of it in some capacity because I'm sure, working the summers as a teen, you kind of saw it all from that point.
Oh, yeah, definitely, yes.
Definitely that point. So if I wanted to, let's say that I'm listening to you here and I'm a teen and I'm thinking about going into the profession of dentist and dentist application, how would I do that? How would I go about that?
Right. So I would say do your research first. Make sure you like it because the mouth is not a pretty thing. It's not for the light-hearted because you will be hit with many different things. And you have to have a strong stomach for it.
Okay.
So you have to love to do this. Do your sciences is the main thing because you're going to get hit with a lot of sciences.
Okay.
But we do have not just dentists. We have our dental assistants. We have our dental therapists. We have our dental hygienists and the dental
therapist?
Dental therapist is like an in-between of a dental hygienist and the dentist.
Okay.
So they're like our nurse, per se.
Supporting the
right.
doctor.
So she can see the kids and do a whole bunch of procedures on them that a hygienist may not be able to. And the dentist, because they have such a workload, it helps them out.
Okay.
Right? So it's a 3-year course, the dental. Well, I can give you that rundown too, if they want to know.
Well, you know what, folks? We're going to take a break and come right back. We're talking to Dr. Thammy Powery from the HSA. Is it dentist doctor or Dr. Dent? How do you pronounce that?
The degree says doctor in medical dentistry.
Okay, doctor in medical dentistry, Ms. Thammy Powery. We're going to come right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions. Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Once again, folks, welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about your mouth, the ins and out of it with dentists. What's the official title of it?
Doctor in medical dentistry.
Doctor in medical dentistry, Dr. Thammy Powery, and she hails from the and I had to throw this. She hails from the Republic of West Bay.
Gosh.
I love West Bay, and she's a homegrown product, and she's over at the HSA. We were just talking earlier about what it takes to enter into the field and the different levels, because it's more than one.
Right. It's more than just the dentist.
Right.
We have a whole team of us.
You have a whole team. So give me a little bit about what kind of the jobs and the time it takes, and maybe if you know the amount of coursework, not coursework, but the years it may take,
Right.
just to break it down for any listener who may be wanting to go into that profession.
Okay, so we'll start with our dental assistants. The dental assistant course is 1 year. There are online programs as well that are offered. But basically, all in all, if you go face-to-face, it's a 1-year course. So they'll teach you everything of what you need to do to help out the dentist. Mm-hmm. Then you have your dental hygienists, which are the ones that clean your teeth, help you with oral health, give you all the different toothbrushes and whatnot to get you sorted in that aspect. Mm-hmm. Their course is a 2-year course. So it's a compact 2-year course where you have both clinical and theory based on it. Then you have your dental nurse or dental therapist, which is an extension of the dental hygienist. Mm-hmm. So that's a 3-year course in some places. In other places, it's a 4-year course.
Okay.
Then you have your dental lab technicians. That's a 5-year course. They're the ones that make your dentures, your crowns, your bridges, all the handiwork that is given back to the dentist.
All of that is done in-house?
Yes, we do all of that here at the HSA.
Wow, okay.
The only thing we don't do, unfortunately, anymore is the implants. Hopefully we'll get it back.
Okay.
But yes, so our dental technicians do all that. And then you got the dentist. Mm-hmm. Now, the dentist, it varies on where you go to study for it. It's normally a 5 to 7 year course. It's really extensive.
It sounds extensive, and I'm assuming a lot of this is hands-on theory and hands-on work.
Right. So the first 3 years is theory. Once you hit your 3rd year, then you start seeing somewhat of patients. You start doing cleanings, diagnosing, and charting up. Then your last 3 years, depending on the course. Mm-hmm. So the last 3 to 2 years or 4 years is the whole clinicals of it. Okay. So your extractions, your perio, your crowns, all the different surgical procedures that you do. Rotations included as well.
That's incredible. Normally, I would have not thought that it was that extensive. But then as you keep talking about what it entails, I realized that, I could see the artwork into it, because, sometimes I've seen people and they smile and I'm like, wow. They're like, I got my teeth done. And they go into what it was before. And it looks so normal nowadays that you can't really tell the difference between what was, God-given and what was doctor-given.
True. And this is just the general dentist. Mm-hmm. Now, if you go into one of our specialties, there are several specialties that you can go into. You got your ortho, which is the one that gives you the braces. Mm-hmm. You have your periodontist, which is the one that deals with solely your gums, anything to do with gum disease. Okay. You have your endodontist, which is the one that does all the root canals, specifically hard root canals and whatnot.
Yeah, I've had a few of those.
And then you have you got your aesthetics, the one that makes them nice and white or perfectly to look exactly like your teeth.
Right.
You have your maxillofacial surgeon, which is the one that does the really difficult third molar extractions. or reconstruction of face if you have any, say, accident that breaks your jaw or anywhere in the face.
And the strange thing about that, I mean, things have changed due to the social media and TikToking, things of that way. I was following a lady whose jaw had an overbite, and she was going into what it took to basically reconstruct her jawline. And I'm thinking, wow, she was like, yeah, they broke my jaw the other day and pulled it back 2 inches. And I'm thinking, I would have never even heard of this, thank goodness for TikTok and stuff. But the dentist, and that is to me, that's insane. That's crazy. But this is people's life that they, and she was like, I finally can chew properly, chew and swallow properly. I can taste my food.
And her whole facial feature changed dramatically as well.
Exactly. And this was part of it. She was saying, that I think she was in her late 20s or so. And she said, when this developed, when I was 13 and 14, they said that I needed to wait till I was in my 20s to have this done, and finally getting it done. But literally, she said, I could not chew my food. I basically was swallowing soft food, and now I think she was eating a steak or something like that. Okay. And it was just, the level of information. I did not even know that was possible, but yes, it is.
That's what I'm saying. It's good to do your research if you're interested in any of these fields and in any specialty as well.
Oh, awesome.
That way you know what you're getting yourself into.
Yes. Of course, she was like, it's been 2 months for healing, but was super, super happy with it, and this is I'm assuming kind of the level of the norm where most doctors of that caliber would be at for something of that nature.
Yes, that's very complicated surgery, extremely complicated surgery, which you get to as well when you do rotations. They get to go into the OR to actually see these different procedures so that, if you like it, you may pursue it.
Right.
Or if not, you're like, nope, definitely not for me. I ain't doing that, no.
Yeah, understandable. Once again, folks, thank you for tuning in. We are in conversation, full dentistry mode with Dr. Thammy. She's over at the HSA. If somebody needs to make an appointment to see one of the doctors at the dentistry, how would they do that?
Right, so you can call the hospital number, 949-8600, and get transferred over to dental to make an appointment, or you can go in and make an appointment to see us. Yeah.
Super, super easy. And now that we're coming out of all the COVID and stuff like that, and we were able to I remember I actually had a procedure that I needed to get done, and I waited 2 years, literally for COVID to finish, because they was like, yeah, Chuck, we got to go into your mouth, and we can't do that while there's COVID. So, thank you for doing what you do and continuing on the path. Any final words you want to wrap up and say before we get out of here?
Well, I just hope that it helps to inspire any of our young Caymanians to come out and do dentistry, medicine, anything in the medical field. There's a lot more than just banking on the island.
I think we're coming to that realization that, the world's a big place, and not to say that you can't take banking with you.
No, of course not. That's your backup.
Right.
You can have as many backups as you want.
You can have as many backups as you want. I like this lady. She tells it like it is, and you know what? I'll be happy for you to check out my teeth anytime. I'll be
sure.
Like, yeah, go ahead. I got 2 broken molars and some other stuff. Just teasing you. But thank you so much, Ms. Tam, for stopping by here
Thank
today.
you for having me.
Excellent. And Mom, if you're listening, you did an awesome job. Thank you so much. We got a doctor sitting in our building. This is Healthcare Today with the HSA. I'm Chuck Taylor. We'll be back in a few.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
And we are back. Once again, welcome to Healthcare Today with HSA. I'm your host, Chuck Taylor. And as we continue talking to our medical professions right here in the field, want to talk to Dr. Brandon Bernard. He is the emergency medicine consultant over at the HSA.
Yes.
So, what does that? Introduce yourself. Go ahead. Tell us a little bit about you.
So I'm Brandon Bernard. I'm a Caymanian, and I've just come back home about a year ago after completing my medical training with a specialization in emergency medicine. So, basically, I'm trained to handle anyone with anything at any time. So
in a nutshell.
In a nutshell.
Pretty much. So anyone, anywhere, anytime. That pretty much constitutes emergency medical.
So trauma, heart attacks, strokes, runny noses, and everything in between.
Everything in between. Wow, that's a broad outlook on health.
Yeah, it is. I'm a member of one of the very few specialties that doesn't treat just one organ system.
Okay.
So, we have cardiologists, they're amazing, but if your problem doesn't have anything to do with the heart, that's not them.
Okay.
I am dealing with patients regardless of what's happening. So basically my specialty is if you need to see a doctor right now, you might be dying.
The person
I'm the guy to go to.
And I think, to me, being in Cayman, such a small community, that probably is an everyday occurrence. So you probably see a lot more than the average doctor would see, because once again, based on what you're telling me, they have specialized areas. So you make a consultation to see them. You deal with emergency trauma as it walks in the door, basically.
Basically, yeah.
Wow.
So
what made you decide to dive into it? Because that is a broad, and folks, if you just tuned in, welcome to Healthcare Today with HSA. We're talking with Dr. Brandon Bernard, and he is the emergency medical consultant, basically treats everything, anytime, anywhere. But what made you decide to get into that area?
So I love emergency medicine because you get to see patients get better immediately right in front of your eyes. Mm-hmm. People come to you on their worst day. Let's face it, if you happen to come to the emergency room and see me, you probably weren't planning on getting sick. Something happened you weren't expecting.
Exactly.
And on that horrible day, I have the opportunity to be able to assist, to be able to bring that person back to health. So that's a blessing for me.
Wow. And one of the things that we hear I know in most medical professions, there are several years to reach that level of being a doctor. Is it extended because you have so much different facets of it? Because say, just calling out, you said cardiology, 5-7 years plus, but now you have a wider range of medical background.
It's a very unique challenge that I'm trained to face. So the training is very long. I was 17 years old when I left Cayman.
Okay.
I'm now 35, and I just got back last year. So
wow,
that's a long time.
That's a long time.
So during that time, I'm gaining experience. I'm doing a lot of things, gaining new skills. And now I'm fortunate to be able to bring that experience back home and help my people.
Awesome. Once again, thank you so much for the dedication that entails. I don't think people understand. When we see you in the ER, you think of, it's a doctor. But that is a very specialized and very critical part of it, because you are able to assess and basically deal with everything that, as you said, that comes across your board right at that point in time. That may be a life or death situation.
Many times it is, and unfortunately, there's sometimes that there's nothing we can do. We're just, as a community, still grieving right now because we've experienced tragedy.
Yeah, I know. This past weekend, we've lost a lot of good souls, but this weekend was, we always talk about losing people in their prime. And there are some times that, as you said, there's nothing that you could possibly do to avert this tragic situation. Yeah, and our condolences go out to each and every family who has had that experience, because we as a small-knit community see that, we hate to say it regularly, but it's become a pretty regular occurrence, and I implore, people out there, please don't drink and drive. That is one of my pet peeves. I hear every Monday morning, I kind of grit my teeth to say, okay, let me check to see what happened this weekend, and alcohol and drinking and driving, that's a bad combination.
And speed.
Of course, yeah.
A lot of our guys are addicted to that adrenaline.
Yeah. And, I remember growing up and watching y'all racing bicycles, and I'd rather you race bicycles than cars and bikes and things of that nature, because, under certain circumstances, it may not end well, and as I said, kudos and condolences to all the people who try to make a better change. And thank you, Dr. Bernard, for being one of those. And what made you, we know the extensiveness of it and you wanting to help. Was there something that made you kind of hone in on ER, or that was just something that you decided?
I've always loved healthcare. I was that child that loved to go to the dentist's office.
Really?
I was that strange guy. And I didn't always want to be a doctor. Growing up here in Cayman, seeing these air shows coming, I wanted to be a pilot.
Okay.
I wanted to fly these planes around.
So it's super exciting. Yeah.
But I always tended to enjoy the sciences, and I drifted towards that. I liked problem solving. I liked working with my hands. And I got a summer job working at Christie Tomlinson, now Doctors Hospital.
Right.
Back in the day. When
Dr.
Dr. T opened his hospital, that was a big deal for the community.
Of course.
And I was actually working in maintenance. So I was pressure washing the building, spraying ants' nests outside, working outside, manual labor. That was my first introduction to the healthcare field.
So we have a doctor who is no stranger to hard work.
No.
Not at all.
Definitely very comfortable pulling my sleeves up and getting the job done.
Of course.
And that lends itself well for emergency medicine, because we get to do those procedures that are life-saving. And it makes a difference when you're able to save a life. And don't take that lightly.
Of course. And I mean, in your profession, beside being, I'm assuming you're on call at ungodly hours, because that ungodly hours is usually the time that things happen.
Yep.
Yeah. What's the most challenging? I shouldn't put it that way because I'm sure every day is no day is unlike another, but challenges that you face in the job. Tell me a little bit about that.
So the largest challenge that I have is having to face families and deliver tragic news. Sometimes, despite your best efforts, the patient didn't survive to the hospital. And the relatives, they're expecting to see their loved one. And sometimes you have to let them know, and that's never easy. And seeing a mother grieve for her son, or father grieve for his son, or any other family member or friend, that is catastrophic for me. I've never gotten used to that. So I try my best to never have to do that.
Right. And people, we always assume that you guys are supermen and women. And
We're definitely not.
Yeah. And that's just it, because of what you're trained to do is not the average. So with people understanding that, they kind of hope that there's something that can be done. And that's with everyone. And when there are moments when all your best efforts can't do what they wish, that probably, you're human.
Yeah.
And that is the hardest thing to, as you say, to deliver to a grieving family, to tell them that, despite the modern medical technology of medicine, there's nothing we can do at this point in time.
But it makes a difference when you're working in your own community, right? These aren't just patients for me. These are people I've grown up seeing. These are people that know my parents.
Right.
These are, very close friends of the family. So you go the extra mile, because at the end of the day, you're going to have to look someone in the eye and said, we tried everything that we could. And I want to make sure that I'm able to say that and mean it.
And be comfortable saying that, literally everything that we have tried, and this is, yeah.
Yeah, but it doesn't have to be morbid. Sometimes
I
nice
know.
to see a familiar face and
Right.
somebody that understands you. And we have a lot of very good outcomes. At the HSA, we have a very wonderful hospital. That place is a gem. And I don't think people really appreciate it for what it is. Everybody wants to go elsewhere and go overseas. But we have something special right
We
here.
have a world-class facility in our backyard.
And I've trained all over the place. I was in the UK, I was in the US, I was in Jamaica, I was in Grenada. But there's no place like home.
True. And that is the thing. I think sometimes over the years we have a tendency to look overseas for services and things of that nature. But we have better when we're at home. And the reason why I say better is you have the ability to go home after.
Yeah.
And that alone, just think of it, Cayman. Just think for a second. You had a procedure successfully done, and you're able to go to your house afterward. Your sanctuary, your home, not get in a taxi, not go to a hotel, not go from a hotel to an airstrip, not get on the airstrip in customs immigration and fly X amount of time to come back home. You have this opportunity to get better here.
And be surrounded by your friends and family.
Exactly.
To me, that's almost the best medicine, knowing that you're around people that care. And it's not that, you're sacrificing something. We have excellent physicians right here. I work alongside them every day. I know that they know their stuff.
Perfect.
And it's very comforting to be able to say that,
Nice. If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're going to take a moment and be right back. We're talking with emergency medical consultant physician, Dr. Brandon Bernard. We'll be right back. Keep it locked in right here on Bobo 89.1 FM. The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions. Now back to Healthcare Today with HSA and our host, Chuck Taylor.
And we're back at Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking with emergency medical consultant physician Dr. Brendan Bernard. And we were talking a little bit off air about some of the things that you're passionate about, especially being homegrown, being a as they say, a son of the soil. Tell me a little bit about your views on healthcare and things that you see that's around us today.
So I'm a little different compared to a lot of doctors. I believe that people should be taking as little medications as possible. If you can get away with not taking any medications, to me, that's better than having to live taking these pills every day. Mm-hmm. And a lot of the illnesses that I'm seeing here, that I'm back home, it's all related to our lifestyle. We have a lot of really good food here. Mm-hmm. And some people don't have the opportunity to do as much exercise as their doctor would hope that they do. And it's making them have to go on these medications. And I just want to talk about that. Your medicine should be your food.
Right.
You know, your lifestyle.
That's the thing that you intake. That's your first line of defense is what you eat.
Exactly. You are what you eat. Mm-hmm. And I would love to see people live more healthy lifestyles here. The other thing that I'm seeing is that we have a very heavily medicated society, and people are taking some serious stuff like addictive medications, opioids, benzodiazepines. And that's very concerning because before I left here, I wasn't seeing as many people taking those medications. Uh-huh. And I want to get the word out that, you know, there's an epidemic going on overseas, and I don't want to see the same thing happen here at home.
And, you know, it's strange you should bring that up because I was watching, it was a newscast, and they were talking about, and this was in South Florida, they were doing an undercover sting on one of the pain physician clinics. And literally, people were driving in from out of state, buying pain medicine, opioids, and going back. And these were, people have to understand, I don't think Cayman is aware of it, but there is a drug culture that thrives on this stuff. And not to say that we have it here, but abuse of painkillers and pain medication can be as quick as today I'm feeling pain, tomorrow I'm hooked.
Yeah.
It's literally an overnight thing that, and then all of a sudden, when you don't have it, you feel bad. Well, feeling bad is different from feeling pain. And I think that's the thing that our society needs to understand. Feeling bad, you may have a cold, you may need to walk a little bit, you may need water in your system. There are things that naturally you do when you're feeling down. It could be simple as depression. You may have an instance of being depressed, but that does not constitute as physical pain.
And if you're going to turn to a medication that is going to, over time, make your pain worse, to me, that doesn't make any sense. Mm-hmm. If you're going to turn to a medication that will decrease your ability to function day to day, that might not necessarily be the best option. And I get it. People don't want to be in pain. Pain is terrible. And there's entire specialties devoted to dealing with pain, especially chronic pain.
Mm-hmm.
But I think that people need to understand that sometimes all the time you need to give people all the information that they need, and sometimes they don't want to hear that, this medication, if you take it for too long, you're not going to be able to stop taking it.
Right. It's a short term thing, not a long term use. And it's so I see people in Cayman. We have a very understanding society. We have access to lots of different things that normal countries generally don't have access to. So if someone is feeling chronic pain, they say, okay, what's the root of this pain? Rather than treating I see, and I'm not a doctor. I'm not a physician.
But you have common sense.
But I have common sense.
The source.
Treat the source, not
cause. Not
I
the
understand
symptom.
you want immediate relief. Granted, that immediate relief should be able to be had, but then let's dig a little deeper. Let's find out what is the reasoning for this pain. That should always be a conversation that you as the patient have with your doctor. Doc, why is this happening to me? Rather than, Doc, can I get this fixed?
Yeah.
I would think that would be where I would want to be. You should always, my father, God rest his soul, used to say, there's a couple of people that you always need in your life. You need a good doctor, you need a good accountant, and you need a good lawyer. And you should be able to talk to them as if you talk to your wife. And so you should be able to have honest conversations with these entities in your spectrum to say, hey, I'm getting up at XYZ and I'm having this immediate pain. Why?
Exactly. And you need to be able to trust that physician. And at the end of the day, if my patient doesn't trust me, I could write any prescription. They're not going to fill it. They're not going to take those medications. Right?
Uh-huh.
So having that relationship with your physician is very important. And I want to offer that to my community now that I'm back home.
Perfect. Doc, man, you are a blessing and understandable. So we were talking a little bit about education and getting into the realm of health care. Who were some of your mentors? Because medical Cayman, we've always been told we're a financial community. Medicine has been opened for a field for quite some time. Tell me a little bit about that.
So I started working at Doctors Hospital, or at the time it was Chrissy Tomlinson Memorial,
right?
When I was 14. And every year I'd go back in the summers and I'd have a little job. And Dr. T, I guess, must have seen something in me, because he took me aside and he started grooming me. He started giving me classes and said, why don't you read this book? I have this extra book. And every year I'd go back, and eventually I decided, this is what I want to do. I went off to undergrad. I have a degree in biochemistry with minors in finance, because I'm from Cayman.
Of course,
know about money.
you got to know where the money comes from.
Spanish language and literature. After that, medical school. And I was fortunate to do medical school in Grenada and then clinical clerkships in New York City and in the UK. After that, I went to... I came back home. I did my internship here. So I'm the first Caymanian doctor to do internship here in the Cayman Islands. I, at the same time, did an MBA. So I have an MBA in multi-sector healthcare management.
You're a busy young man.
Yeah, I'm collecting these degrees. And after that, I went to Jamaica, did my senior house officership. So I have experience working in anesthesia and intensive care. And I did emergency medicine. And then I went on to complete specialization. So my doctorate is in emergency medicine. So I'm now a consultant physician. That's the top of the ladder.
Okay, excellent.
And now I'm home.
And now you're home. Well, as I said earlier, it is a joy to have you in kind of the headship of it, because, I'm trying to think of a time when it wouldn't be an emergency, but everything, when it comes down to it, it starts at that point when tragedy, and I don't want to sound morbid, folks, because there are times that things happen that doesn't end in the morbid side of it. But then it's good to know that somebody has the ability to look and say immediately, okay, we need to do this, we need to do this, we need to do this. And that comes from seeing kind of the other side of the spectrum, to know where is that line that says, okay, we start at this point and we do this. And thank you so much for doing that. And just tell me some of your passions. What does Dr. Bernard do when he's not on call besides sleep?
I like running.
Uh-huh.
I like scuba diving. I like eating good food.
Okay.
And I love traveling.
Okay. Yeah. Excellent. Well, folks, this is one of the bright stars over there at the HSA. And thank you so much. In closing, what do you want to tell our Cayman people? I mean, if you could sum up, something that would be profoundly interpreted by the masses out there, what would Dr. Bernard tell them?
I would want to speak to that child that's 14 years old and is thinking, maybe I want to be a doctor.
Okay.
I want to tell that child that if I can do it, he can do it. And I think that growing up on a small island, some people have a limited mentality. They think, well, I'm from a small place, my options are very small. They should not have any reservations against what they can accomplish, even coming from a small place like Cayman. When you go overseas, you'll gain the same experience. You'll be in the same schools. You're reading the same book as someone that grew up in a larger country. And we're not inferior to anyone else. And this is our home. And we need to be the best at everything we decide to do. If it's medicine, if it's accounting, if it's hospitality, whatever that person wants to go into, they should be passionate about it and do it to the best of their ability.
Well said. Once again, Dr. Bernard, thank you so much for stopping by here today.
Thanks for having me.
Don't be a stranger. Anytime the platform is yours, we're here for that reason. Thank you so much. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're just wrapping up here with emergency medical consultant physician, Dr. Brendan Bernard. Thank you so much, sir. We'll be back in a few.
Thanks for having me.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.KY.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.